We begin our show today with a look at the COVID-19 situation here in Niagara. Dr. Mustafa Hirji joins us. Dr. Hirji, with the summer months here, students getting out of school, will we see a further decrease or will we see an increase in COVID-19 infections?
It's always hard to predict the future with any reliability, but my best guess is that we're going to see this situation continue to improve. We're thankfully on the downward swing of the wave that we're going through over the last couple of months. Not over yet. Unfortunately, we just reported another person passed away from COVID at the start of this week, but definitely we're seeing much less infection, fewer outbreaks, fewer people passing away. And with the warm weather, I think people will be outside more. The sun, the heat, the humidity is going to naturally decrease the ability of infection to spread. So I think we'll be good through the summer. The real question will be what the fall looks like.
I think most of us have become very complacent. I know when I walk on Queen Street in Niagara-on-the-Lake or somewhere in St. Catharines, most people are not wearing masks. They are outdoors and that seems to be acceptable. But there are indoor situations where sometimes I feel I should be wearing a mask, nobody else is. And I've found myself, I used to keep a box of masks in my car and I haven't restocked that recently. I keep forgetting to do so. We can't be complacent.
Yeah, no, I think that's absolutely right. Now, you talk about people being outdoors. For the most part, outdoors, I don't think you need to be wearing masks. If you're outdoors with, lots of close interaction with people, that's maybe a case where you want to think about masks more. But, you can be out walking the streets, going along Queen Street. That should not be an issue. As you note, going indoors, that's where there's more risk of infection because someone who's infected with COVID-19 will breathe out that virus and it's going to float in that air. And that mask is going to prevent that virus from getting out from the person who's infected and prevent you from then breathing in that air. Masking is a simple thing we can do to continue to keep us protected. I really think we're in a stage of this pandemic now where we should be able to go back to doing all of our activities. Everything should be open. We shouldn't be having those kinds of restrictions, but we should be still taking precautions. And I think getting vaccinated and wearing masks are those two key precautions.
It's really important right now for everybody to have a few rapid antigen tests at their home. So when they feel some symptoms, they can test themselves.
Yeah, absolutely. I think, the rapid antigen tests are still being freely provided by the province through grocery stores and pharmacies, and really helpful to have some of those on hand. If you do get sick with symptoms, you can check to find out if you have COVID-19 and know if you need to let other people know to look out for that. If you've been around someone who's had COVID-19, you can start doing that testing to make sure that you don't actually develop infection, especially asymptomatic infection. So if you do get infection, you can stay home, you don't put other people at risk. I think it's a really sensible thing to have on hand, and especially since it's free, it's a no-brainer.
Doctor, the last variant of any concern was really the Omicron variant, and we know that it was a little bit milder, but that was really back in the winter, approximately January, I think, when it became a factor. We haven't seen another variant here, and we're in mid-June.
We haven't seen a new variant that is, causing a new wave yet. But, thinking back, we had the Alpha variant that popped up in late 2020. We got the Delta variant in mid-2021. We got the Omicron variant in late 2021. It seems to be several months apart before that new variant comes along and gives us real trouble. So, we haven't seen it yet, which is good news, but there's every chance we could. And, because most countries now are letting lots of infection spread, I think it increases the chances that the virus could mutate and a new variant could arise. The other thing to be notable about is that while we haven't had a new variant per se, we've had mutations of the Omicron variant to deal with what we're calling subvariants. So this most recent wave we had was caused because a new subvariant emerged called BA2, which led to infections, and that's now causing trouble in the US. We have a subvariant of that now, BA2.12. There's also subvariants BA4, BA5 that appear that they could cause small waves as well. So we're still seeing, maybe not a new variant, but these kind of quasi-variants emerging. And I think we need to be vigilant about the possibility of those still.
You mentioned one of those variants popping up in the United States. Is it too early to get rid of all of those demands on Americans coming into Canada yet?
I think we want to have the borders open. As I was saying, we should really be going back to doing everything with some precautions. And so we shouldn't be restricting people from traveling per se, but we should have some precautions still at the border. And I think, every country in the world pretty much has some kinds of border measures. That includes if you're unvaccinated, maybe having to quarantine. It means that checking for people to be vaccinated, therefore to determine that, and possibly occasionally having some testing. What I think we're seeing is that some of the border measures are maybe not being done in a way where it minimizes some of the hassle of it, and that's, I think, what people are really concerned about. And what's unfortunate right now is every country I mentioned has border measures, but we're all doing it differently. And it would be nice to come up with a common international standard, a common proof of vaccination you show, a common set of rules. So if you're going on a trip, you're going to have the exact same rules for the 2 countries you visit, plus when you return back to Canada. And I think that would really simplify some of that overhead burden that businesses are concerned about.
On the subject of vaccinations, here in Niagara, 81% plus with 2 doses, only 50.6, I think it was, percent with 3 doses. And I think you've been quite adamant that we need to increase the number of people with 3 doses.
Yeah. Key to point out about the numbers you highlighted is that is looking at our entire population. So age 0 and up, of course, including children who can't be vaccinated. The 2-dose number is over 90% if we're looking at adults, which is great. But as you say, the 3-dose number isn't as good. 50% overall in the population, 60% amongst adults. We're really seeing it's younger age groups who haven't got that 3rd dose, and I really think this is one of the key things we should do. I mentioned vaccination, masks remain the 2 main things we need to be doing to protect ourselves, and hopefully we can convince those people over the course of the summer to get that vaccine before the fall when we might start to see another wave.
You had a vaccination clinic at the Outlet Mall in Niagara Falls this week. Are there plans for more of these?
Yeah, we're actually here at the Outlet Mall all week this week. We're basically alternating 1 week at the Outlet Mall, 1 week at the Penn Center, where we have actually rental space permanently, or I shouldn't say permanently, but for a long period of time. And then we're doing the odd pop-up clinic in other locations, places like Waynfleet or Port Colborne and other locations which are less well served. We have no plans to stop doing our vaccination for COVID-19. Given that we're seeing fewer people getting vaccinated for COVID-19 these days, we'll probably start to be offering other vaccines at those clinics at the same time, which will be particularly important for our school children who've missed getting vaccines during grade 7 the last couple of years to start to get those vaccines out in the community before they go back to school in the fall.
Last question for you. The mask rules for hospitals and public transit are being lifted this week. Is it too early to do that?
Yeah, and I don't think it's particularly the right thing to do quite yet. When I'm looking at our data, particularly wastewater data, I'm seeing that we still have a fair amount of infection spreading, definitely on the downswing, but hasn't got back down to the low levels we've seen in the past. And those are high risk opportunities for infection to transmit. And they're particularly places where people are perhaps disadvantaged or more vulnerable are going to be. People who are older, people who are lower income, who are at greater risk from COVID-19 are the ones who are more likely to use public transit or more likely to be in a hospital or a healthcare facility. And I think it makes sense to keep masking for a little bit longer, at least in these facilities, to protect those most vulnerable people. Again, it doesn't mean we can still ride transit, we can go visit our loved ones who might be in the hospital. We're just wearing a mask. It doesn't seem like a big inconvenience, I think, and it's going to make a big difference to protect people.
Thank you, Dr. Hirji, for all of that information. We'll check in with you again later this summer.